Good morning. My name is Amber Mentor-Trupa, and I'm the Vice President of Communications at the Shriver Center on Poverty Law. Welcome to the Shriver Center's 2021 Virtual Gala Series, The Road to Recovery. Today's event focuses on building an economy that works for everyone. I'd like to thank all of our sponsors for funding this series and the Shriver Center's ongoing advocacy, training, and litigation efforts. In addition, I'd like to give a special shout out to our title sponsor, GCM Grosvenor, presenting sponsors AARP Foundation and Sidley, and platinum sponsors Denton's and JP Morgan Chase. We're so excited to have you here with us for the second conversation in our year-long series. Y bienvenidos a nuestros participantes que hablan español. Llame al 312-854-3105 y use el código de participante 339-896 seguido de la tecla numeral para escuchar este evento en español. And some quick Zoom tips. Use the chat feature at the bottom of your screen to connect with us and be in community. And use the Q&A box during the panel discussion to ask your questions. Please take a moment to tell us who you are and where you are joining us from today in the chat. Welcome, welcome. And while you do that, let me share about us. The Shriver Center on Poverty Law leads the fight for economic and racial justice. Here's a bit more about our story.
And now, a brief video about the Shriver Center. Roll it!
In so many ways, this moment in time is so crucial for the Shriver Center as it is for the rest of the country. Shriver's work has always been evergreen. As long as there's been poverty, as long as there's been racial injustice, we've been here fighting that good fight. This is a moment where our work is being highlighted. For everything that we've been saying for over 50 years, talking about why it is so important for us to be focusing on racial and economic justice, people now see manifested in COVID and manifested in this period of racial awakening.
Change laws and change lives. Not one, not two, not thousands, but millions of people.
Today we litigate, shape policy, and train multi-state networks of lawyers, community leaders, and activists nationwide.
We see ourselves as building up an army of advocates that are equipped to do their anti-poverty work with racial justice at the core.
Understanding as a legal advocate that you are working in partnership, in collaboration with community, and you are not the lead of this movement.
There's more of an urgency when it's actually your situation.
We need to make sure that our systems are giving people what they actually need to live a dignified life.
To unapologetically tackle racial inequities.
This is just a fraction of our work, and there's still so much more to do. And that's why we need to use this momentum to propel our work forward.
Using litigation and policy advocacy to affect change where it's needed most.
You're actually part of this right now. We're all part of the movement.
No podemos hacer esto sin ti.
And we can't do this work without you.
We are the movement! Go forth and use your voice for positive change. Thanks for coming.
As we just said, we can't do this work without you. Our three-part Road to Recovery series offers opportunities for you to take action and partner with us as we work towards a just recovery. Today, we hope you will join our movement with a donation to fuel our advocacy, training, and multi-state networks. Many thanks to the generosity of Sunny and Paul Fisher for offering to match the first $5,000 in donations dollar for dollar. Let's see what we've raised so far. All right, we have raised $3,670. That is great. And because we're so close to our match goal, we decided to stretch. So with your help, by the end of this hour, we want to raise $7,500 in support of the Shriver Center's critical work. And $5,000 of this will be matched. So let's help this thermometer move even further. Just open your phone's camera and scan the QR code that you see on the screen right now to make a donation. And we're also dropping a link in the chat where you can make a contribution as well. Thank you so much in advance for your support. I will keep you posted on our progress throughout today's webinar. The road to recovery continues as we emerge from a global health pandemic, economic crisis, and racial reckoning. While it might start to feel like we are returning to some sort of normalcy, we can't ignore the fact that millions of people remain in poverty. Police violence continues to harm Black and Latino, Latinx communities, and inequities in medicine are just starting to be addressed. That said, we saw the American Rescue Plan include landmark policies that we know can help end child poverty and support working people and those unable to find employment. But we need any short-term policy efforts to continue as permanent long-term solutions. So what stands out to you in 2021 as we work together to recover and rebuild? Everyone should be able to meet their basic needs, but systemic inequities and structural racism make it nearly impossible for many people to achieve financial stability on their own. And as we continue to shift towards a gig economy, workers and their families face greater harms and risks, including reduced compensation and benefits, uncertain schedules, and the denial of important employment protections. Today's conversation will highlight strategies for ensuring economic justice for all. We're going to dive into guaranteed income, fair pay, and workplace protections for low-paid workers. And immediately following the panel discussion, join Shriver Center staff and advocates for an optional follow-up discussion on one of two topics: strengthening worker protections or moving toward a guaranteed income. We hope you'll join us. Before we get into today's conversation, let's first hear from Beatriz, a domestic worker with the Latino Union of Chicago.
Hola, soy Beatriz y soy miembro de la Unión Latina de Chicago. El cambio que yo deseo ver para los trabajadores es que tengamos un salario digno y justo, que se respeten los horarios y las responsabilidades acordadas, que los empleadores sean conscientes de proveer equipo de protección personal para evitar cualquier accidente y cuidar de nuestra salud. Como trabajadora del hogar, me gustaría que se reconociera, respetara y valorara más el trabajo que hacemos, ya que en esta crisis de salud nos pudimos dar cuenta que somos trabajadores de primera necesidad y por eso merecemos un trato digno y salarios justos.
So let's dig deeper into some of what Beatriz rightfully just shared. I now want to introduce the Shriver Center's President and CEO, Audra Wilson, who will moderate today's conversation and introduce our panelists. Welcome, Audra.
Thank you, Amber, and hello to everyone. Basic economic security, particularly for those who have been systematically excluded from it due to racism and sexism, is vital to everyone's dignity, survival, and ability to make choices and have some autonomy to make decisions that impact their lives. That's why economic justice is at the heart of the work that we do at the Shriver Center, as it has been for nearly 60 years. Even though the Affordable Care Act has provided health coverage for millions of people who otherwise would not have been able to obtain coverage, medical debt continues to be the primary cause of bankruptcy filings in the United States. So long as rents continue to grow faster than incomes, we will perennially be dealing with a housing crisis. And all too often, poverty is a proxy for neglect in the child welfare system, as Black and Brown children are more likely to be removed from families that are struggling financially. From combating the stigmatization of low-wage workers to fighting for full access to the social safety net, the Shriver Center fights against deeply ingrained policies and practices that exploit or punish the poor simply because of their economic status. Today's topic could not be any more important as we emerge from the weight of the global health pandemic, with economic repercussions will continue to be felt for the months and years to come. Despite its devastating impact, COVID has exposed the plight of low-wage workers in America, many of whom are the essential workers upon whom this nation was completely dependent for several months at the height of the country's countrywide shutdown. As much as we yearn for certain aspects of our pre-pandemic lives, for low-wage workers in America, returning to normal is not a viable option. To the contrary, advocates around the country are forcing lawmakers to use lessons learned by COVID to provide fairer wages, work conditions, and benefits that will enable families to truly be able to sustain themselves. We are honored to be joined by three dynamic advocates for economic justice who will share their thoughts about what needs to be done to build an economy that works for everyone. Michael Tubbs is the former mayor of Stockton, California, and founder of Mayors for a Guaranteed Income, a network of mayors developed in response to the COVID-19 crisis and the Black Lives Matter protests of 2020, advocating for a guaranteed income to ensure that all Americans have an income floor. Ai-jen Poo is a co-founder and executive director of the National Domestic Workers Alliance, a nonprofit organization working to bring quality work, dignity, and fairness to the growing numbers of workers who care and clean in our homes, the majority of whom are immigrants and women of color. Roberto Clark is the executive director of Warehouse Workers for Justice, a worker center fighting for stable living wage jobs in warehouses and distribution centers that also educates workers on labor rights, while fighting for public and private policies that promote full-time work at decent wages in the warehouse industry. So let's start off by doing some level setting for our audience. When we talk about employees, it's important that people understand the difference between categories of workers. Ai-jen, I'm going to actually start with you. And first of all, I'd like to congratulate you on your recent profile in People magazine. And in that profile, you state that growing up, I saw my mom and grandmother, who both had full-time jobs and did so much caregiving for our family, for the community, for neighbors and friends. I noticed how much of that work was invisible, undervalued, and taken for granted. You also describe moving to New York City and witnessing this very invisible army of women of color who are caring and cleaning for the families across the city and making it possible for everyone else to do what they do in the world. So to make sure that everyone understands the terms that will be used throughout today's discussion, could you please define for us a domestic worker? And are these types of workers entitled to things like paid sick leave, vacation, and family leave?
Absolutely. And I just wanted to start by thanking you, Audra, for your leadership and the Shriver Center, your incredible team for your partnership on advancing the rights of domestic workers and low-wage workers. It's just been extraordinary to be able to partner with all of you. And thank you for putting me on a panel with my favorite mayor and also with Roberto, an amazing organizer. So when we talk about domestic workers, we're referring to the nannies, the house cleaners, and the home care workers who provide caregiving and cleaning services inside of our homes. It's a workforce that's more than 90% women and majority women of color, Black, Latinx, API, Native women. And it's also majority primary income earners for their families and majority mothers of young children. So really important people in their own communities and families. And it's the work that makes all other work possible. We believe that without care work, nothing else is possible in our society and in our economy. And yet it's completely undervalued and insecure work. We call domestic workers the original gig economy workers because they have always worked to try to piece it together without job security, access to a safety net, consistent hours, or even a consistent job description. And 82% of domestic workers came into the pandemic without a single paid sick day. And so it's been rough out here for domestic workers for a long time, and it's certainly rough right now.
Thank you, Ai-jen. Very important, just sort of level setting that we're doing right now. And I want to carry on what you talked about too, and invite Roberto to be part of this conversation. We've all become more acutely aware of the warehouse workers, especially with increased demands for delivery of goods from the last year's stay-at-home orders. So, Roberto, can you describe for us the conditions of a typical warehouse worker? And are they entitled to things like paid sick leave and other sorts of benefits?
Yeah, you know, our society really became even more dependent on warehouse workers over the course of the pandemic. And the pandemic really underscored how important this workforce is. A lot of people increased their usage of Amazon deliveries and things like that, and really as warehouse workers. And a lot of major retailers also increased their e-commerce deliveries, whether it's Target, or Walmart, or Costco. So this is definitely a trend where we became even more dependent on these warehouse workers? And the answer is, generally not receiving sick time or extra protections during the pandemic and before the pandemic. We had a report, the COVID jungle, and there's some key findings. 65% of people in the workplace got infected or knew someone who did. 85% of those who reported what happened got retaliated against. 61% of them did not receive pay from their employer if they were sick or forced to quarantine. 83% of workers reported that they've gotten sick from COVID, that they did not receive paid sick leave from their employer or government assistance. So really it was a crisis not having these basic accommodations for workers during the crisis. And they paid a big price for it. Warehousing and manufacturing in the state of Illinois was the most dangerous, or the second most dangerous place to be during the pandemic. So the people who kept food on our table, who got us our household goods, predominantly people of color. 90% of the people who were part of our report were people of color, paid a heavy price during the pandemic. And it's definitely something, we, as the executive director of this organization, I feel a responsibility to honor and remember that sacrifice that essential workers made for us, because they allowed many of us to be safe. And if we want to honor that sacrifice, we can get them things like sick time, health insurance, family leave, all these things. This is the way we should honor their sacrifices during the pandemic, in our opinion.
Well, thank you so much, Roberto, because that's what you're talking about is something leading to my next question. I'd like to also bring in Michael to this conversation. So many pundits, economists, and even lawmakers seem to be surprised by the number of jobs that have opened up but remain unfilled. And there's been a lot of consternation about people not returning to work, so much so that many states have been ending unemployment benefits to those who've been laid off during the pandemic as a way to supposedly incentivize, or in reality, coerce people back to their jobs. But you've alluded to this, and let's talk more specifically about it. What's really happening? What do you think are some of the reasons why these positions are remaining unfilled? Roberto, I'm going to start with you first, because you've already started to talk about the conditions in the warehouses and how easily we created an environment of transmission of the virus. But tell us more about what you think some of the reasons why these positions are remaining unfilled, and then I'm going to turn it over to Mayor Tubbs.
Once again, I think it goes to a central issue of like really better pay and benefits, and I think we need to take put ourselves in the place of the essential worker over the last year, really realizing just how much they went through. I read it as a statistic, but many of our workers knew someone who died in their workplace, right? Many of them know people who got sick, who got their family sick because of their job, that these workers have gone through a tremendous toll over the last year, and they're not receiving the benefits, pay, or accommodations that they needed. And the hazard pay is going away, the flexibility in scheduling is going away. A lot of these things that incentivize people to, want to do these jobs are not going away. So it's, really not a surprise to see workers not want to return to this workforce that they didn't have a good experience with or had terrible experience with over the last year.
Definitely. Mayor Tubbs, how about you? What do you think are some of the reasons why people do not want to return to employment?
Yeah, well, if I may, Ms. Wilson, before answering that question, I just want to spend a little bit of time just unpacking sort of the 400 years of history that give rise to explanations that speak to people who do the hardest work in our society and generate all the wealth for everyone else as lazy, as not willing to go to work, as not willing to contribute. And we've seen that since the end of slavery. And one of my mentors, Jim Lawson, talks about plantation capitalism, or this idea that the capitalism in the American form is really built on the back of essential workers and low-wage workers. And that at any point in history, whether it's sort of abolition, and folks were given the agency to decide which type of jobs they wanted to take after slavery. And then we had all these vagrancy laws, making it criminal, making it a crime to be unemployed, particularly for Black men and women in the South. And we see that through line continuing even today. So I think what we're seeing is a rise in worker agency. I was just reading some reports from economists who spoke to how actually people having more flexibility in deciding where to work is a sign of optimism, a sign that I can actually pick a job that treats me with dignity. We spend all this time talking about the dignity of work, but I think Roberto's work and Ms. Poo's work really illustrates the fact that the issue is that we have a lot of jobs in our society that don't treat people with dignity, that don't allow people the dignity of sick time, the dignity of knowing your schedule for a week. So I think what we're seeing is that now with a somewhat functioning safety net, people are able to make the best decisions. And the last thing I'll say is we're still in the middle of a pandemic. The vaccine rate in this country is 60% or something like that, which means that millions and millions and millions of people are unvaccinated, that we still don't know the impacts on children. So I think people are making smart public health decisions, and particularly in places where folks aren't taking this virus seriously, or folks aren't being vaccinated and saying, if I go to work, I may bring this to my family, to my grandmother, to my child, and I have a little bit of a safety net so I don't have to take such a risk of my life and my children's health in order to put food on the table. So I say it's a good thing that folks have agency, are deciding which types of jobs to choose to work in.
Oh, thank you, Mayor. And actually, I'm going to run with what you just said. The rise in worker agency. I want to kick us over to Ijen. So as Mayor Tubbs was talking about this rise in worker agency, in this moment, Ijen, do you think that low-wage workers actually might be able to exercise some bargaining power that they've never enjoyed before?
I do. And I also believe that that window is going to be short and that we have to make the most of it. And that we have to do everything within our power to support worker agency with structural reforms that make it easier for workers to have more power and to raise the minimum wage and to do all the things that we know are necessary for this economy to actually secure itself and to secure workers. So this is kind of a moment where there's a window where structural reforms that can reset our economy are possible. Workers have more agency, but workers are also still struggling. I think the labor shortage narrative is also really overblown, that there's really just a few sectors within the economy that were really profoundly hit in the pandemic, in hospitality and in-person service sectors, and also sectors where women of color were disproportionately concentrated. And those are the same women of color who've been disproportionately impacted by every single other form of structural inequity in our economy and the lack of childcare, the lack of elder care, all the pieces that, the lack of paid leave, all the pieces that have made it really impossible for women in this economy going into the pandemic, all exacerbated on the shoulders of women of color coming out of it. And so I just think we have to keep it all in perspective, understand that it's always the people with the least amount of power and resources who are bearing the brunt of our, both in terms of having the most at stake in terms of actual structural change, but also having to bear the most responsibility for our safety and security. And so how do we put them at the forefront of how we imagine this moment of action and transformation, and doing it in a really timely way? So we both have a sprint and a marathon ahead of us, I think, to get to the economy that we want, and leveraging their voices, their experiences, their leadership, and their agency right now to win as big as we can.
Thank you, Ijen. So many important things that you talked about. And I will say that for the Shriver Center, that has been much of our conversation about recognizing this very specific moment in time. And we use the analogy of it being a window. And we say there's a window of opportunity, but that window will be open for only so much time. And so I'm really glad that you alluded to that. And also that you put in perspective this question that I asked to really talk about how we overblow the discussion of labor shortage and really what does that mean. So thank you both for answering that. I want to turn now actually to this concept that we started off with guaranteed income. And Mayor, I'm going to go back to you. So when we think about income, we've heard about many campaigns for raising the minimum wage or otherwise supplementing people's incomes. Many of our attendees today have heard terms like living wage or the fight for 15, and they may have even heard concepts about universal basic income. Now, you became the champion of a concept called guaranteed income, and you were the founder of the Mayors for a Guaranteed Income. So would you explain to our audience the concept of guaranteed income and why you began this crusade for the residents of Stockton, California? And as you describe this, please share some of your findings from your pilot program, the Stockton Economic Empowerment Demonstration, as well as the similarities that you've seen in other municipalities that introduced pilots like yours.
Yeah, well, in its simplest form, we have a guaranteed income now in this country, thanks to the work of President Biden and Vice President Harris. That folks go to childcare. I'm gonna get the website wrong, but there's a website that ends with .gov, where families who make $150K or less with children are guaranteed at least $500 a month on the 15th of every month for at least a year. It's an income guaranteed to those folks. And the idea of a guaranteed income is as old as this country itself. Thomas Paine was talking about this in the late 1700s. Childtaxcredit.gov, there it is. Dr. King was calling for this before his death. And the idea is to create a baseline, a floor upon which no one could go beyond, whether they're working or not. And I think we've seen, particularly in this pandemic, that that's important, that unemployment insurance is great, but unemployment insurance works if you were once employed. But if you don't have a job because you're an artist, because you're a student, or because you do domestic work at home as a caregiver, then that work isn't compensated. Even though if you did it next door for your neighbor, it potentially would be. That it allows for everyone to have a baseline level of economic security and to build economic resilience. So what we found in Stockton, where we gave people $500 a month for 24 months. And this is all data from pre-pandemic, which means these results are probably going to be magnified when we look at the impacts of COVID-19. We saw that people didn't stop working, but it gave people, again, more agency. People were able to leave part-time work and move to full-time work 2 times more so than those who didn't have a guaranteed income, despite the fact that before the program, they were statistically the same. We also saw that unemployment was 2 times lower with those who received a guaranteed income than those who did not receive a guaranteed income, meaning that something as small as $500 actually allows people to work because it allows people to pay for all the things that are make it difficult to get to work, which isn't kind of lack of motivation or work ethic, but actual real things like transportation issues, like childcare issues, like not having a uniform or not having the clothes to wear to go to work or not having access to a washer and dryer, et cetera. But we also saw, and this is the most important stat for me, an impact on mental health. So we saw that those who received a guaranteed income before the program on the Kessler scale were elevated in terms of level of anxiety and depression. They were mildly depressed. But after 1 year of receiving the guaranteed income, they moved from depressed to not depressed, comparable to clinical trials of Prozac, meaning that something like so much of the stress, anxiety, and mental illness we see in our society is a manifestation of poverty, economic insecurity, in a brutal economy that doesn't give people the wages they need, but then penalizes them or talks about them for not being able to afford the things they need to live. And the last thing, and what we've seen kind of across this country now with 53 mayors saying they're a part of Mayors for Guaranteed Income, with about 15 pilots from cities like Columbia, South Carolina, to Oakland, to Los Angeles, to LA County, to Pittsburgh, to St. Paul, to Madison, Wisconsin, et cetera, is that all these mayors and elected officials are now realizing that we actually don't have to have poverty, that we actually don't have to have economic insecurity, that it actually, we all do better when we all do better. So we're super excited again about the work of this administration and that child tax credit. And very excited by the leadership of governors like Governor Newsom, who put money in the state budget to support some of these pilots, but moving towards a policy. And I think the big thing on our agenda is ensuring this child tax credit becomes permanent, becomes just part of the American social contract and building from there.
Great. Thank you so much, Mayor. And I want to also expand this and something that you've mentioned, and then also Roberto mentioned earlier in his comments, and that's just this notion of, we seem to be as a society more bothered by the possibility of prospective costs to business owners than full-time workers not being able to make sufficient wages to sustain themselves or their families. So I'm going to open this up to all of you, and I'm going to start with Roberto. Do you think that there's some belief that low-wage workers are perhaps disposable and as such not as deserving of living wages?
We definitely saw that during the pandemic. That was clear. And where we work outside of the largest inland port in the country, and it's really a home of up to half the Fortune 500 companies, right? So Amazon's the big one, but Walmart, Home Depot, all of these players. And in our report, it was focused on food brands, but major food brands. 49% of people didn't have any health insurance at all. Another 20% depended on Medicare or Medicaid, right? And we're talking about the corporations in this country that are most able to afford both good wages and benefits, right? So we definitely saw that play out during the pandemic with really devastating consequences. And the high rates of infections in Black and Brown communities, we would definitely correlate to people getting these infections in these big workplaces like warehousing. And people don't go to the doctor because they don't have health care, right? So there are probably pre-existing health conditions that made it more likely that people passed away or got seriously ill.
Thank you. Imagine I'm going to bring you in, and then Michael. What are your thoughts about? Do we think of people as being disposable?
I believe that yes, that we have in our society and in our economy a hierarchy of human value, where we value the lives and contributions of some over others, and it is cruel and unsustainable, and that our policies reflect that. Now, I will say that as somebody who's worked with low-wage workers for about 25 years now, this pandemic, I believe, has created the greatest single opening to address the conditions of low-wage work that I've known in my time doing this work. The fact that we had so many of us recognizing that so much of the work that's done in this economy that was invisible to us before, that we did actually treat as unskilled and not valuable and invisible, is actually essential to our health, our safety. And in fact, it caused a lot of us to reflect on the fact that if all of that was essential, could it be that all work is essential and should be valued and protected and recognized as such? I think is kind of the process of, it's part of what we saw in the pandemic. It was part of one of the things that was revealed that we now can't unsee. And now the question is what we do with what we've seen. And I think we, again, have this moment of opportunity to raise the minimum wage, to strengthen the ability of workers to organize, to establish, make permanent the child tax credit, to make care jobs, the jobs that are about caring for the people that we love the most in the world, actually good jobs instead of the poverty wage, unsustainable jobs that they were. All of this is possible, like really within reach. Well, I'm not even talking about our big dreams. I'm talking about like, this is actually, we can make this happen right now. And only now, because in a few, who knows what 2022 will bring. So that's kind of the moment that we're in. It's like, we have this long history of treating people as disposable. We had an epidemic of low-wage work before there was a pandemic. and we have the cures, and now it's just about implementing.
No, it's that we're going back to that window closing, so we need to take advantage. So before we actually go to our Q&A from the audience, Michael, I'm going to have you the last word on this. And I have a feeling I know what you're about to say.
No, I guess for me, and I really struggle with, and it happens every time I'm in conversations with folks like you all who have been doing this work and explain it so simply. It goes back to the hierarchy of human value comments mentioned earlier, but we literally treat people as if they're radically different from us. Like, what policymaker, what person on the Zoom call would work on a job with no benefits?
Right.
Without the ability to set a schedule, without sick time, without pay time off. Yet we expect millions of people to do that, mostly women of color, and don't bat an eye. They think it's normal. Like, so I think it's a policy conversation, but I think it's deeply rooted in a moral and kind of spiritual conversation we have to have as a country about, like, who is our neighbor and what do we actually owe each other? Because we literally live in a society where we think things are good for us, but other people don't deserve them. And we see it show up in any conversation, from healthcare to guaranteed income to the right to organize. And I would also say, particularly when we talk about workers organizing, the fact that there's such pushback to that is wild to me. Workers understand they need employers to be workers. like no one's organizing to bankrupt their employer. Like people, and that's what gets me. It feels like the people are so logical and so pragmatic, but we have these crazy ideas and these fears and these ideologies that I really believe are deeply rooted at the intersection of patriarchy and white supremacy, that create conditions where, even in the midst of a pandemic where people can't work, where folks are tired because they spend 5 hours with their kids a day, and I can't do this, I need to bring my nanny from her family and quarantine with me in Long Island. It's just so wild to me, but it just goes back to this idea that we don't see each other as equal, we don't see each other as deserving, and we really have to have a conversation about what does it mean to be human, not even American, like, what does it mean to be human first? And then from there, I think we'll be able to build all the policies and things that humans need to be human. So sorry for the sermon, but
oh no, you're on the mountaintop there, Michael. It's okay. And it's a very important point. Why we're not trying to bankrupt employers, because we need employers. So I appreciate that. So before we go to our audience Q&A, because that chat is lighting up, so I'm excited to see that, we're going to turn it back to Amber for a quick fundraising update.
All right, thank you, Audra, and thank you to our panelists. This really important and insightful conversation. I think a key thing I'm walking away with, that we should all walk away with from what you all have shared, is that this rise in worker agency, it's a sign of optimism. We only have this window to push for some really important structural change. So before we get to that Q&A, let's check in. I want to check in with you all on our important ask of the day, fueling the Shriver Center's economic and racial justice work with a donation. So may we see the progress that we've made on our donation. Oh, wonderful. So we just hit that match. We passed it, $6,738. Wonderful. Virtual round of applause. Thank you all so much. Okay, I must ask, look at that thermometer. Can we get to that stretch goal? Every dollar counts. $10, $25, $100, $1,000, whatever you can give, we really appreciate it. So we still have time. Here is that QR code. Again, you can scan that to make a gift. And we also put a link in the chat right now where you can make a contribution. So thank you for allowing us to meet that match. And I know that we can get to that stretch goal by the end of the conversation. So let's hear from you. The chat is lighting up, but a really helpful way for us to organize the questions is to use the Q&A box in the commands at the bottom of your screen to enter your questions. Again, because of time, we may answer some of those questions directly in the Q&A, and the chat is helpful for comments and observations. But again, that Q&A box is really where you can ask those questions so we can organize them. Audra, do you have a question teed up so that you can ask?
I do. There are many. And it's interesting. Many of them are reflecting the conversations that have been going on, including why we are only now considering what we deem essential workers essential, and haven't they always been? So really great questions. Here's one that's kind of uh, asking about why we might make this distinction in terms of whether we pay benefits out. So I'm going to actually throw this to you, Aijen. And the question is, how do you see the notion of skilled versus unskilled labor factoring into the conversation about living wages, healthcare, benefits, paid time off, et cetera? And is that a meaningful distinction to make?
Well, as someone who works with a workforce that has been devalued, and every frame in our vocabulary that's possible to devalue someone and someone's work has been used against this workforce. I think we should seriously question whether frameworks of skilled versus unskilled work are actually serve us. The idea, domestic work, care work is considered unskilled, but if you have ever done this work, you know quite well how much skill is required to uphold the human dignity of an older person who's becoming more frail or who has Alzheimer's or some form of dementia, to support the ability of a person with disabilities to live a full life in their community, including to work, to have real agency as a human being. It actually requires skill. To nurture the human potential of a child. Tell me that is unskilled work. Any parent, I challenge you. So I think we have to really question whether these notions are helpful to us. Now, I will say that I believe in education and training, and I believe that one way that we continue to develop our ability to contribute to the economy and our society is through education and training. And so skilling is important. But I would say that we have focused so much on upskilling the worker, and we have focused so little on upgrading the jobs that are available to workers. And that's what I think we need to focus on. And one thing that's really exciting about right now is in the American Jobs Plan and the American Families Plan, 90% of the jobs that would be created and improved in those plans, this is the president's Build Back Better plan that Congress is discussing right now, 90% of those jobs would go to people who don't have a college degree. And those are the people that we have so undervalued in our economy. And opportunities have just disappeared for. Talk about the cruelty and the brutality of this economy. Literally over the past 4 decades, opportunity and economic mobility has basically disappeared for that population within our American economy. The fact that 90% of what we're talking about right now in terms of good job creation would support that population, I think is critical.
Wait, can I say one thing real quick? Because I just want to make sure you get credit because I'm about to tweet this. That was a brilliant paradigm shift in frame, so thank you for that. So much time spent on upskilling workers, but what about upgrading jobs? That's brilliant. I'm stealing it. You guys heard it here first.
No, thank you. And I wish I could moderate and take down all these notes. So I'm glad this is being recorded because there's just too many good things that are coming out right now. I do want to ask a question, and I'm going to actually kick this to Roberto because it's a little bit of what I think that you do in your position as executive director. But the question is, how do we engage essential workers more into this type of advocacy?
I think that, for us, we work with warehouse workers in one of the most important logistics hubs in the world, right? And they have the power, right? They could completely shut down the economy if they got organized, right? We were completely dependent on them to get us goods, right? And I really feel that we have to appeal to their self-interest, get them on board. Aijen's right. This is a unique, unprecedented opportunity to actually change the conditions of essential workers. They were always essential. They were always important. And we can really, I mean, there's a sense, we need to act with a sense of urgency that we can't ever let what happened to this workforce ever happen again. There was no reason for it. We could have saved countless lives with better access to sick time, insurance, better pay, workplace safety, the list goes on, right? So I really think that we need to appeal to people's sense of moral outrage over what's happened in the last year. We need to fundamentally change these kind of industries, whether it's domestic work or warehousing and logistics, because nothing moves without us is our logo, our slogan. And, you know, we truly believe that. And, you know, we really want to do some unprecedented organizing coming out of this crisis.
No, thank you, Roberto. I now want to throw something out to all of you. And Roberto, I think you had mentioned this initially. We're talking about impact right now of conditions. We're talking about impact on households. There was certainly, you mentioned about mental health, which is especially the stress of that, the stressful work environments people are in, combined with the very low wages and how this can have an impact on our mental health. One question that came in was actually talking about some of the impact on our children, socially, cognitively, when their families and their parents are having to endure this type of stress. So I want to find out for anybody, I'm going to throw this out there, who would like to speak to what they've seen in terms of, even just anecdotally, about impacts on children of low-wage workers and those who've been struggling during this pandemic.
Well, I got to say, this was an incredibly stressful time for workers with families, right? And that childcare and being able to accommodate for that with the school closures and things like that was incredibly precarious. And that we know more than one worker who lost their job because they weren't able to manage things like this. So I think that this has been, it's been stressful for the worker, but definitely, you know, we've seen the impact on the families of these low-wage workers. So, and I think that's a very important point to highlight, that the instability of the job definitely had an impact on the family.
Thank you.
Go ahead, Michael.
No, I'll be brief because I know you have something brilliant to say, but not even just the instability of the job, but just the anxiety that's produced when the whole world is shut down because it's so unsafe for people to work, but you still have to go work. Like that, like even that concept is so bizarre to me. Like really shut everything down. Can't leave your house, can't do this, can't do that. But for these folks who traditionally make a little bit of money, you still have to work. And we had people protesting because they didn't have people serving them food at restaurants, et cetera. And I think that just stress, that anxiety, that fear, and we're hearing all these stories even today of folks who work in supermarkets who are being murdered for telling people to wear masks. Like I think all of that contributed to a kind of really unhealthy sort of fear and trepidation, and fear being twofold. One of, if I don't work, what happens to my family? How do we eat? How do we survive this pandemic? But B, if I do work, what if I get this illness? What happens to me and my family? Putting, again, fellow human beings in really tough situations, which I think will contribute, and not to mention the stress of childcare, the stress of not having reliable internet in a lot of cases, not having quiet spaces in your 2-bedroom house you live with 8 people in for your children to take their classes. Like, I think your kids being antsy because they're in the house all day. I think it's again, it goes back to the resilience though, and the brilliance and the strength and vitality of folks, because those would break a lot of people, just all those pressures and stacked up against each other.
Hi, Jen, I want you to answer this, but I also want you to close us out as we're getting close to the hour. And just think about for a second, with all these folks who are on, what are some of the lessons, and it's kind of wrapping up what we've all been saying, but what are some of the important lessons that we need to take from this moment as we move forward? Again, thinking about the window analogy and how little time we have to really make some significant change.
Great. Well, just to add quickly, I've been thinking about some of our members who worked as essential or continue to work as essential workers, as home care workers, for example, and serving as the only lifeline to some of the people who are most vulnerable to the virus, older people, people with disabilities. You are the person that your clients count on to bring medication, food, sometimes the only human contact for months on end. And you also have young children at home. So you have to make a decision to bring your child with you to work, keep them sitting on the porch while you support your client, or figure out a way that they get COVID tested before you're going to see your client. I mean, the kinds of choices and what people had to navigate who were caring for themselves and their own families and responsible for the care, including the care of some of the people most at risk in this situation. It was just a daily onslaught of impossible choices. And then you had people who dramatically, just immediately lost their jobs and income. And, this care work, a lot of the work that women of color do is work that by definition can't be done remotely. So you either keep working as an essential worker or you just lose all of your income. And how are you going to pay for your phone bill, which is the only way your kid gets access to online learning and is able to stay connected to school? How are you going to make sure that in your studio apartment in New York City, that your kid stays sane, trying to stay connected while actually not being able to have any of the supports available to you? And what if that kid is immune compromised? These are all things that came up through the pandemic on a daily basis for our members. And it's not over, y'all. It's not over. Our kids still don't have vaccines. Camps are opening and closing. I mean, it's still just a really impossible time for our caregivers and our essential workers, which brings me to the moment that we're in, which is that we have to remember everything that we saw and was revealed in the popular consciousness, how essential all work is, how important safety is, how we actually have to raise the floor and provide guaranteed income supports like the child tax credit, how we need to invest in care as infrastructure. Just like roads and bridges, we need care. Even the men who are going to be building our roads and bridges need care for their families. So these things that we learned, we have to hold on to and cement them as our new reality, both through winning the policy, like after this Zoom, you're going to get on the phone and call your entire delegation to Congress and let them know how much you care about these ideas and these policies and get them done, like you're counting on them. And then we have to figure out how we continue to make these ideas our new normal. Because these shifts in our culture and in our narrative can be very fleeting, because the forces that were behind our status quo pre-pandemic were so strong and powerful, and they're still strong and powerful. So it's really on us, the people, to flip it and make sure that whatever has opened up for us stays open for as long as possible so that we can build out of it.
None of us could have said that any better. So thank you. So I want to thank all of these, our panelists. I want to thank our audience for some wonderful questions. But again, thanking Roberto, Michael, and Jen. I wish we could continue this conversation, but we will in some way, shape, or form. So we do thank you so much for joining us today.
Thank you, Audra, for leading that conversation with our panelists. Incredibly dynamic. Thank you so much. Now, It's time to act. Working together, we can ensure everyone is paid decently and has basic workplace protection so that they can sustain themselves financially, be healthy, and be able to take care of their family. I want you to hear from my Shriver Center colleague, Kenya Lambert, on the power of your gift during this time.
Thank you for joining today's conversation. Behind me is the monument to the Great Northern Migration by Allison Czar, right here in the Bronzeville community on Chicago's South Side. The monument represents the journey of millions of African Americans migrating from the South and heading to northern cities much like Chicago. They were fleeing the violence of the South in the early 20th century. They were in search of freedom, opportunity, and quite honestly, just a better life. We all know that our country was founded on the legacy of exploiting free labor and low-wage workers. Today, Black, brown, immigrant families are still in search of fair wages and a better life. I believe that it's time to remove the pick yourself up from the bootstraps narrative and replace it with real economic justice, especially for communities that are still disenfranchised by systemic racism. Now, if you believe in changing laws to change lives, then I encourage you today to make a donation. Use the QR code or use the donation link. I believe that we can exceed the $5,000 match. The Shriver Center is advocating for laws and policies that prevent worker exploitation and provide real economic security for low-wage workers. Again, I ask you to make a donation by using the QR code or the donation link in the chat. Together, I believe that we can build an economy that works for everyone. Again, thank you for joining us today.
Thank you, Kenya. Thank you for this history from your community in Bronzeville and for that call to action. And thank you all again for the gifts and the support that has been coming in throughout today's program. So let's see where we are with gifts. We could get that thermometer back up. All right, wow, amazing. $7,198. Gonna say $7,200, why not? We met that match. How exciting. And so we are so close to that stretch goal. I wanna once again thank Sunny and Paul Fisher for that $5,000 match. So just think we're gonna add $5,000 to the number that you see here on this screen. And that is going to really fuel the Shriver Center's advocacy work. Thank you. We will still take some gifts until the end of this program. If we beat that goal, we will update before we close. Here's that QR code again that you can scan. Share the link that's in the chat with a friend, post on social media, come to the conversation room in the next half hour to get more inspired and then fuel our work. We have this window of opportunity. So we really appreciate all you can give. Thank you so much. We've been discussing if we value workers, we must push for systemic change. All right, so we've had 2 powerful conversations and 1 more to go. Our next Road to Recovery event is in early October. We're going to explore what real change looks like for communities of color. We're excited to announce our keynote speaker very soon. Registration will open this summer, so stay tuned to your email and our social media for our announcement. All right, for those continuing on with us today, we'll see you in a minute in one of our 2 conversation rooms. Please visit povertylaw.org/continue and follow the link on that page to the conversation that you wish to join. All right. To close us out, let's collectively share an important goal. We're not in person to chant together, but we can type in the chat, economic justice for all. Please type that with me, economic justice for all. I want to thank you so much for joining us today, for all of your gifts. We are so close to hitting that stretch goal. So we'll send you an update after this program. Thank you for all that you do. And I'll see you in a moment in one of our conversation rooms. Take care.